Hello guys, it is medical information, and in this session I want to talk about treatment of type 2 diabetes. In previous session I've mentioned that diabetes type 2 is the ninth cause of death worldwide, and it is so important to be familiar with this disease and with its treatment. So let's begin. First step to treat type 2 diabetes is lifestyle modification. Lifestyle modification in type 2 diabetes includes consuming low carbohydrate and low fat diet, low salt diet, because diabetes is usually complicated with hypertension, and it is important to restrict your salt consumption. And it is also important to receive low calorie diet, because weight loss needs a low calorie diet, and a significant weight loss can improve your insulin resistance and improve your sensitivity to insulin, which improve your blood sugar and decreases your need to medication. It is also important to consume vegetables and fruits and prevent using fast foods and foods from restaurants, or fatty foods. Exercise, particularly the aerobic exercise, is a very important step in decreasing body weight and improving your cardiovascular health in diabetes. As I mentioned previously, diabetes imposes a high risk of cardiovascular diseases, and it is very important to decrease your risk of dyslipidemia and decrease your body sugar by performing aerobic exercise. The preferred method is 20 minutes for 5 times per week, and it is very important to be aerobic, and anaerobic exercise is not very helpful in this case. In most cases, it is preferred to choose a tight control for blood sugar, because it can prevent cardiovascular, renal, neurologic, and ophthalmologic complications of diabetes. You can self-monitor your blood sugar, and charting your blood sugar can show you, is your diet restriction enough for blood sugar control or not, and it can help you to regulate and adjust your medications. Also, measuring HbA1c every 3 months is recommended to observe the effect of medications and lifestyle modification on your blood sugar control. And also you must know what is the target for blood sugar control. In young patients, it is very important to have a fasting blood sugar of between 80 to 130, and a blood sugar of 140 to 180 2 hours after a meal. Also, a HbA1c of less than 7 to 7.5 is preferred. However, patients who are severely ill or are complicated with cardiovascular diseases, they can have higher blood sugar, and tight control is not suitable for them. And After lifestyle modification, you must be familiar with medications of diabetes. You must know their benefits, their side effects, and their dosage if you are using the medications. Metformin is commonly used in diabetic patients as the first line of medication, and it is very helpful to decrease your body weight. It is an insulin sensitizer, and it can also improve your renal failure. But insulin is contraindicated and can't be used in patients with severe heart failure, severe renal failure, or those who are hospitalized and those who are at high risk of liver failure or acidosis. Sulfonylureas are a type of drug that can increase insulin secretion from the pancreas, and they can impose high risk of hypoglycemia, and for that reason they must be used with meals, and if you use them without eating something, you are at high risk of hypoglycemia. They can also increase the risk of fracture. GLP-1 agonists, it means they are type of drugs that they are analogs of the incretins. Incretins are substances that can decrease your appetite, and they can decrease your food uptake, and thereby they can decrease your body weight. And nowadays it has been demonstrated that GLP-1 agonists like semaglutide and tirzepatide are effective in decreasing body weight even in patients without diabetes. And dipeptidyl peptidase 4 inhibitors also increase the level of GLP-1 agonists. Indeed, they inhibit the enzyme that can degrade the GLP-1. SGLT2 inhibitors are type of drugs that they increase the renal excretion of your glucose. They are cardioprotective, and they can also protect your kidney against chronic kidney disease and diabetic nephropathy, but there is a substantial risk of genital infection, and you should be aware of that. And finally, insulins. Insulins are used in type 2 diabetes in case of disease progression, and if the blood sugar is not controlled with medications and oral agents, then insulin is prescribed. Insulin can be used together with the other medications, and it can be injected as rapid-acting insulins by every meal, or as long-acting insulins every day or twice a day. Insulin pens have a number on their head that can be changed by rotating the head and regulating the number. By regulating the number, you can control the volume of injection. The injection must be constant, and you need to cooperate with your physician to determine which amount of insulin is proper for you and can properly regulate your blood sugar. Also, there are intermediate acting insulins and short acting insulins, which are nowadays used in hospitals, they can also be used in house, but because of ease of the using, rapid acting and long acting insulins are preferred. Finally, you should know how to use insulin pens and where it is the proper site of injection. The dorsolateral side of the arm and the lateral side of the thigh and also pre-umbilical area are preferred for insulin injection, and the insulin pen must be injected with a degree of 45 to 90, and there are also other types of care that you should be aware if you are a diabetic patient. A daily inspection of your feet is needed to prevent and avoid diabetic food. Diabetic food or diabetic sores are kind of sores that usually have not pain because of peripheral neuropathy. You can feel pain and you are at a high risk of diabetic sore, and it can lead to foot amputation. Blood pressure control is also of importance in diabetes because diabetes is usually associated with diabetic cardiomyopathy and diabetic kidney disease, and it is essential to tightly control their blood pressure if you are a diabetic patient. Also, an annual visit of ophthalmologist, nephrologist, and your cardiologist is helpful to prevent unwanted renal and cardiovascular and also ophthalmologic complications, because diabetic patients are at high risk of diabetic retinopathy, visual impairment, and diabetic kidney disease or myocardial infarction, stroke, and other end organ damage. If you enjoyed this video, please don't forget to like, subscribe, and comment, and see you soon.